We know what happens when you take testosterone. You have more energy, you feel better, you gain muscle, you lose fat, you get stronger. There's a reason why all these professional athletes want to take this stuff. Pretty good expectation it's going to work. And the added bonus is sexual function.
Hello, ladies and gentlemen. Welcome to the Wittmer basement. I have the man, Dr. Wittmer, here with me today. I'm really excited to get to know you a little bit more, share with the good folks out there a little bit more about your practice and what we got going on. And really excited about diving into some questions that I had when I was getting ready to get started with you guys and kind of smash maybe some of the questions out there for some of the other people as well. And then we're going to dive in a little bit to specific circumstances with patients as well, which I think will be really cool there at the end. So to get it started, Doc, I've been with you guys now since September and been on my own personal journey, and I'll be honest, seen really good results so far. So I'm interested to hear from you. What got you into this? What made you start, diving into the HRT space and starting to help these patients?
I got old. Pretty simple. I competed in Olympic weightlifting back in the 70s and the 80s, at a pretty high level. So you know what that means. And as you go through the aging process, having come from that background, you're measured by hard, cold numbers. There's no argument that 400 is more than 300. And as you go through the aging process, and you just can't do what you used to do. And that's tough. There will never be PRs in my lifetime again. And you go through a period of time where you think you're doing okay, then it seems to drop a little bit. My body changed. Instead of being 240 pounds with a 33, 34 inch waist, I was 238 pounds. So I was very happy I didn't gain weight. However, my waist was 42. So what was up here went down. What was down went up. My wife and I will be married 42 years come May, and going through the menopause process with her, as a guy, you got to see firsthand what women go through and appreciate that even more. It was really rough on her. And we just got to the point where, what are we doing? We don't have to put up with this. So we got into it as patients, and then that evolved to we just started this practice. Really, it sounds kind of blunt and brutal, but just to be honest, is I don't want to go down a frail old man.
That's my favorite quote you say.
Well, this is a choice for most people. I tell almost everyone, you're not sick. This is an option. It's an elective. I don't want to go down a frail old man. That's just my nature. That's why I want to live my life. I have no plans on retiring. I'm sure sometime I'll be retired. Because something will force me to retire, but I like what I do. I love what I do. This doesn't really work for me. And having the hormones of a young man makes it easy to do this. I tell a lot of my patients that if a bad guy wants to take a wallet from an old man in a parking lot at night after dark, they're probably not going to pick me. Now they may get mine, but there's others that'll be easier to get. And that's the guy I want to be. Yeah. Nobody would look at me and be impressed, but they would look at me and think, that old man looks like he still works out. And that's kind of where I'm coming from with that. Lifestyle choice. Same thing for the women. They want to maintain their health and their youth and their vitality in all aspects of what we do on a day-to-day basis as long as possible. That's really where we're coming from, and really the kind of the motto of the practice.
That's awesome. You already said so many things that resonated with me. I got 2 little daughters and I want to be the scary dad, right?
That's right.
So I'm okay with that.
Keep those boys in line when they show up.
That's right. That's right. So helping somebody like me has gone a long way as well. I know for me personally, Doc, it was something that before I got started, I had a lot of questions about. And I think anybody that takes the time to research this stuff, they're going to run into a lot of information, some good, some bad. We try to always, of course, put out the best information. So what's some things that you're seeing currently, or maybe you're hearing from patients that are potential red flags you'd like to knock out here right out of the gate?
We do labs, and we look at the lab results and hormone levels as well as other health parameters. But ultimately, what we do is we optimize hormones based on results. And you get to decide the results, of course, within reason, but your goals, your objectives, your desires, if you want to say symptoms, we could say symptoms, but that's what we base this on. We use the lab results as guidelines to give us some direction as to what options you might have. And, in talking to patients, I know some of them may even come away a little frustrated because I don't necessarily tell you what to do. These are the options you have. Here's the pros and cons of everything. And you get to decide how you want to move forward.
And that was one of my favorite parts. I know we had that same conversation during my initial consult of, I'm in my mid 30s. I've played a lot of sports. I've always been very active, and I just physically wasn't feeling well, emotionally wasn't feeling well. And so those are my goals. And so those are the things that we attacked right out of the gate. And we're going to talk a little more circumstance here in a little bit. But I know specifically I had wrote down a list of some things that I was potentially worrying about. And I'm sure that some other listeners are probably feeling the same. So I'm just going to we'll call it the hot seat here for a little bit, and we'll just roll through them and go from there. So the first one that concerned me for whatever reason was, will taking testosterone make me lose my hair?
There's genetics involved there, and sometimes testosterone will accelerate that process. More times than not, I have guys tell me that their hair got thicker. So I'm not sure what's going on there either, but I haven't seen that over the years. Guys I know that competed in strength sports where they did a lot of performance-enhancing drugs, I didn't see it then, but really not a problem very often, but there's always some with genetics. Myself personally, I didn't experience really much hair loss until maybe my late 50s, early 60s. I'm 68 now. Doesn't seem like anything happened very quickly. It's just a slow, gradual process, but it happened. It was never a major concern of mine anyway. But I always had plenty of hair and thick hair through my early years and even on into my later years. I can't say it affected me personally. There's been a few guys I think that it did affect, but it's not even something I discuss as a side effect because it's just not that common.
Great. Another question I had was, and I'm sure you're going to dive into this, but how often is this going to be something I'm going to have to dose? So how often am I going to have to take that prescription? Now, I'm sure you're going to dive into a little bit of the details as far as the individual, but I know for me, that was a question I have. Is this something I'm going to have to wake up every morning and that's how I'm going to start my day every day, or how does that part work?
Depends on the individual. Years ago, when they used testosterone replacement in general medical practices, they would do an injection every 2 to 4 weeks. And that was what the Endocrine Society recommended. That's what general practitioners will do, urologists, endocrinologists generally. So the half-life of the testosterone, if it's an oil-based injection, cypionate or enanthate are the most common used, roughly about a week. And it depends on the individual and how quickly they metabolize, because we're all a bunch of snowflakes and we do metabolize medications differently. And I don't even think of testosterone as a medication. It's a hormone. All we're doing is giving you something you're supposed to have anyway. Your body makes it. So I know it's a medication that it requires a prescription. It's a controlled substance, but it wasn't invented by Pfizer. It was invented by God, and we're just giving you more of what you're supposed to have. So the issue with the irregular or at least even not very frequent dosing is the fluctuations. Some guys are extremely sensitive to fluctuations. Some are not. Those people can do even daily injections. I've got a handful that do that. They tell me they feel better doing daily injections, and who would want to argue with that? Personally, myself, I've done once a week, twice a week, 3 times a week, and every day, other day dosing. And I'm just screwing around, experimenting, trying to see if I could experience what some of the guys tell me they're experiencing. I don't notice a difference. That's just me. But some guys will notice if they go once a week, by the time they get to day 5 or so, their levels are starting to drop, and they can tell. They can feel it. Okay, they can feel it, and they don't like it. Well, we could fix that real easily. We just split the dose up, or sometimes even reduce the weekly amount of milligrams, and they take it every 3.5 days. And it really comes down to how you feel. Once a week is certainly convenient. You don't have to think and remember to do it the second time of the week. I've got guys that do every other day dosing. Guys that do 3 times a week, they'll just do like a Monday, Wednesday, Friday. They can pick their days. There's also transdermal creams that they can take. Those are daily. Sometimes they're even dosed twice a day. Those are absorbed through the skin. They're put on the scrotum where our skin's thinnest. But there's plenty of options there with dosing.
Yep. And you just touched on it. That was going to be my next question. Do I have to use needles? Is
No.
that the only way I can dose?
No, good question, though. The transdermals, they are not 100% absorbed. Some guys don't absorb them well at all. We've had guys try them. They just didn't absorb. And the blood tests will tell you that. Plus, they're not going to really feel better. If that's the case, then obviously injections are the way to go. The advantage of the injections is 100% absorbed. The topical application is not 100% absorbed. So you've got that, and then the difference in absorption from individual to individual. Also, you obviously wouldn't want to go swimming after putting it on or take a shower or anything. It takes a while to dry and absorb through your skin. I tell guys to just put it on before they go to sleep. You can't have intercourse for 4 hours after putting it on because it'll transfer, and you don't want that. I've even had women come in as patients and find out they have very high testosterone levels and their husband's using a cream.
Is it going to affect my fertility when I start my testosterone treatment?
Yes. So there's part of the brain called the hypothalamus, which measures and registers hormone levels. When you take testosterone, your brain will see that you have plenty. So it will stop making a hormone called gonadotropin releasing hormone. Gonadotropin, and you heard the gonad part in there. So gonadotropin releasing hormone stimulates the pituitary, which is in the middle of our head. It's just outside the brain. It's very little. It's about the size of a pea. It's kind of encased in bone. It's a very important part of our body, and it's well protected. The pituitary makes follicle stimulating hormone, FSH, and luteinizing hormone, LH. Those hormones target the testicles, and they tell the testicles to do their thing. So FSH stimulates sperm production. LH stimulates testosterone production, which is necessary for sperm. So once the brain realizes that you're getting plenty of testosterone, you're getting it from an outside source, which is called exogenous testosterone, it will take the day off. And that's going to be every day. So there's no gonadotropin being released. Therefore, the pituitary doesn't see that and doesn't make FSH and LH. We check the FSH and LH levels initially because we try to determine, why is this person feeling the way they are? Where is this coming from? Is it a problem with the pituitary? Is it the testicles? Usually we don't have a reason. They just don't feel good. Their levels have been dropping. They're getting older, or things just don't work as well as they used to. So without FSH and LH, the testicles don't get stimulation to make sperm or testosterone. Now, you're not sterile. We've probably got over 4 dozen patients that have gotten a wife or a girlfriend. Nobody got both pregnant, but when they were on testosterone, even though I told them this is not birth control, so you still have to take care of that end of it, but they went ahead anyway, and you can get pregnant with it. But your sperm count will drop very low, but it just takes one. And that's an issue for younger guys, particularly if they want to have children.
What about on the female side? Does it affect the fertility of females?
No, you could. I'll give you an example. We had a woman, she was seeing another practice, and I'm still trying to wrap my head around this, but she was taking 200 milligrams of testosterone a week. That's a lot. Yeah, that's a good dose for guys. Most of our guys take less than that. So with the 200 milligrams a week, she stopped having periods. And if you're not having periods, you're not producing. And she was in her early 40s. So, that scared her. She wound up coming over to us, and I still wasn't sure I could believe the 200. You sure it's not maybe 20? Where are you going on the syringe? Well, no, it was 200. So in her case, we just stopped. And it took her about 7 months, I think, until she started menstruating again, got her own natural system. So with that massive dose of testosterone, just to give you an idea, the women that this was an injection, obviously, at 200 milligrams a week. Women that are using injections take 6 to 12 milligrams a week. So that's a lot. So yeah, it could if done improperly, but we don't see that.
Which is why it's important to get on board with us and not somebody else.
I have to think there was some sort of breakdown in communication, that she misunderstood. Maybe not. I mean, she seemed pretty sure that she had the instructions right. So I have no explanation.
So you touched on the testicles and what potentially happens there. One of the questions I had was, how would it either help or hurt my performance in the bedroom?
Well, it's going to affect your libido.
What does that mean? I know for me specifically,
sex drive.
As I listened to you guys more, I understood it, but what does that specifically mean?
Your desire. This is something we see with the younger guys, is their probably main reason they want to do this, is they're noticing a drop in their libido. This is something where I would say we're crossing a line now as to, well, wait a second, this isn't healthy. This isn't normal. I don't care what the number is. Now, there could be a lot of moving parts here. If you've got a poor relationship with your wife or your girlfriend or who knows what, and you just don't have that kind of urge. But this is something that these guys will tell me. They've got a great relationship with their wife, who they find very beautiful and physically attractive. So that's not an issue there, but they just don't feel like they used to. It's very frustrating. It can be hard on a relationship. You can tell somebody something, but when you show them, it's different. And we've had some marriages that have been, they're in danger. A lot of times it's usually the other way around, that you've got a guy in their mid-40s. It's where this kind of starts with us, that over-the-hill thing of being 40. And they don't have as much energy. Their body starts to change. They're getting a little bit of a belly they didn't have. They're tired. They're not the alpha dog at work anymore. The young guys are putting the heat on and maybe passing them up. They're not that interested in their wife physically. The wife might even think they're having an affair because they're not seeing the attention. The wife can still fit into her wedding gown. And here's the guy who's 35 pounds overweight. What's going on? You don't find me attractive. This is real life stuff. And the wife will bring them in. Back when we had them in the office before COVID, it was a story where I think the wife wanted to make sure I got all the information. It's hard to talk about as a man. And they might have gone to their general practitioner. If they even ran a testosterone test, doesn't matter what their levels were, they're going to be within the range. But even if they're low, as long as they're in the range, they won't do anything with it. And they'll tell them, your testosterone's fine. You're within the range. You're within normal numbers. You don't need testosterone. I think you're depressed. They offer them an antidepressant. I hear that story almost every day. And, even from some of the younger guys, and, they go tell their beautiful girlfriend, my doctor thinks I'm depressed. I bet that's a real good conversation when the girl, like, you're not depressed, you're dating me. You're not depressed. Guys dating me are thrilled, So yes, there are moving parts there, but testosterone affects your libido. Obviously, you have more energy. You lose some belly fat. You're just going to have better physical function in many ways other than doing squats. And in the bedroom, it's one of them.
So you just mentioned, all the, the route that sometimes people get to you is one of them is antidepressants. I know me specifically, I was on those for a little bit. Your story was exactly what I went through as well. One of the questions I had was, how will testosterone affect potentially my depression if that is quote unquote a real thing in my personal life?
Well, not being a psychiatrist or a psychologist, I'm sure there are people that need antidepressants. They need medication. They need counseling. Thinking it through more in my own terms, and I wasn't depressed at any time, just coming to the realization that you're getting older and this is the way it goes. But we know what happens when you take testosterone. You have more energy, you feel better, you gain muscle, you lose fat, you get stronger. There's a reason why all these professional athletes want to take this stuff. Pretty good expectation it's going to work. And the added bonus is sexual function. Leave that out of the NFL, but nonetheless, that's a real thing. So now I'm 45, my waist dropped 5 inches. I work out. I feel like I want to go to the gym. Well, one of the reasons I want to go to the gym is because I'm getting stronger and it's just not fun again because I'm not fighting the decline. I'm actually going back in the other direction. And physically, you have other things going for you and benefiting your marriage. Now I'm going to be happy. So yeah, that cures depression.
So touching on the emotional side, one of the questions I had, would this cause roid rage? Would it make me an aggressive man or female?
I never really bought into that much. As a younger person in an environment with guys that did a lot of anabolic steroids, you saw that. Now, the guys that were jerks off of steroids, they were jerks on steroids. There's some of the nicest guys in the world off steroids. We're very nicest guys in the world on steroids. And I always thought that some guys just want an excuse to be an asshole. And you can go ahead and be an asshole, that it's not your fault. You're taking something. And also, not to totally discount it as a placebo effect, but they're very high doses. They're not healthy doses. They're not normal doses that you would have anything close to naturally. So you've got to consider that their levels would be extremely high. We had this happen with a woman a while back. She accidentally was taking 80 milligrams a week instead of 8. She got the 0.8 and 0.8 mixed up on the syringe, and she was asking for a refill. And the nurse said, "Yeah, it's way too early. You shouldn't be out. You've got 2 or 3 more months. Are you sure you're dosing properly?" She was new, and I got to eventually see the email chain, and she was commenting, "Oh my God, that's what I did. I've been taking too much. I didn't know. Am I going to be okay? Did I hurt myself?" And then the next sentence she put in all capital letters. She said, "I have to say, though, I feel great," with like 4 exclamation points. Then the next sentence she said, "One thing I've noticed, though, if I get mad, I explode like a bomb." So when I talked to her, it's kind of funny, but then kind of not. But so, well, you don't want to continue this, obviously, or you will be hurting yourself. But this is an easy fix. Don't take any for about a month or so, and then you can start back at the prescribed dose and make sure we get it right. But yeah, there is a thing. It can be a thing.
And that's a great pass on into my next question. Is one of the questions I had is, can I overdose on this? Is it something that I can potentially cause harm to myself if I'm not paying enough attention?
Sure. Some guys will retain more fluid if their testosterone goes higher, because their estrogen will also go higher with it. So they get some bloating, some fluid retention, which could increase your blood pressure. We don't want that. You can increase your red blood cell count, just like guys at altitude. That's not thought to be as dangerous at one point as it was, because these guys that live at altitude, they have a good life expectancy. Actually, it's longer than guys that don't live at altitude. They have a decreased risk of heart disease. I've read the studies. They have a higher red blood cell count because of the thin oxygen. And testosterone stimulates red blood cell production, which is one of the mechanisms behind energy. If you have more red blood cells, you have more oxygen carrying capacity to the muscles, and you're not going to get tired as easily. This is why endurance athletes, guys that are 6'2", 132 pounds, they will take testosterone, not because they want to squat 660, they want to run all day. And the increase in red blood cells, it's kind of like a form of blood doping, will benefit them in that regard. So yeah, if you take a whole lot, now you really got to push it to almost try to do that.
Great answer. Touching on that, one of the things we were kind of chatting about even before we sat down here was if somebody asked me if I'm on steroids. So how would you suggest somebody like me, if, they find out I've been working with the clinic and I'm on testosterone, and somebody, the comment usually follows, well, you're on steroids. How do you tell us to navigate something like that?
Testosterone is an anabolic steroid. Therefore, testosterone is bad for your heart. That's not true. So they put testosterone in the same box with the synthetic anabolics, and testosterone's a normal, natural hormone that we're supposed to have. In fact, it's almost the other way around. We've had guys lose 60, 70, 80 pounds just taking testosterone. They didn't change a thing. They don't work out. Their diet's not the best. They drink beer too much. And they still lost all this weight. That's an outlier. I'm happy for them. That's great. But you should exercise just for overall health anyway. If you're taking testosterone, why not get that benefit out of it? I'm a huge believer in strength training and resistance training. Starting strength is the best thing going out there. It's not even a question. Where you're standing on your feet, you're doing barbell training, you're doing so much for your health. It's good for your bones, it's good for your joints, it's good for your balance, and you're using heavy weights, so you're going to get stronger. And I'm just a huge believer in that. I think everybody should be doing that, at least some extent of that, not necessarily the whole program, depending on their own circumstances. But I don't think it's a bad thing. I would encourage everybody to check into something like that. I also look at it this way. When it comes to exercise, whatever you do, as long as it doesn't hurt you, it's good. To me, you want to stand up, put a weight on your back, and do some squats. Pick a weight up off the floor. It doesn't have to be anything fancy. 5 reps. It's not a heavy single, but it's not doing calisthenics with a barbell where you're doing 20 rep stuff. Stand on your feet, put a barbell overhead. That requires balance, coordination, all the good things that come with lifting weights. That's the best way to go about it.
Yeah, well, I think I can appreciate those answers that you've given so far. You've done a great job. Another realm I wanted to talk about is the influx of women in the HRT space. And I know that we deal with a lot of women at the clinic. Can you touch a little bit more on what that influx is all about?
I think the thought process that women have when it comes to their health and vitality has evolved over the last couple of decades, and I think it's pretty cool. The average woman we see really depends on their age. So we see the postmenopausal women, of course, that are dealing with everything dropping and massive change in the way they feel in terms of their life. And then the women in their 20s and 30s and 40s that are just not happy with their physical fitness or their conditioning. There's a change in the mindset of the women now that are very, very, very proactive. More of them are working out. I know when Jeff started competing in weightlifting, we went to a major regional championships with like 200 kids. There was a junior competition. This is probably 40% girls. Now, back in my day, there were no women competing in weightlifting. And I knew it was coming out. It was a thing, but I hadn't quite seen it at this level. And these kids were good. Now, this was the coolest thing. And now women are going to gyms. They're working out. They want to be strong. I think all the women should be doing starting strength too. The stories I hear from some of these women as far as what it's done for their health. But you should do barbell strength training. You don't have to. If you don't like it, that's fine. Do something. And more women are active now, and they're looking to enhance their life. And this is an option for them.
Okay, so we're going to start with the female age group, right around the mid 30s. What type of symptoms are they dealing with? And then once they go ahead and get their blood work, what are you seeing in their blood work for a woman in her mid 30s?
Okay. Usually women in that age bracket want to get in better shape, physical condition, and libido and energy. Those are the major ones. I might throw moods in there. They notice their moods around their menstrual cycle are very unmanageable for them. Sometimes they're coming off of pregnancies and their body just changes. Once they're finished having children, they just don't feel like they did before they ever had kids. So their whole hormonal system has been disrupted. So they want to lose weight. So they want to lose fat. May or may not want to really gain muscle, but they want to look better. They want to improve their energy levels and, of course, their libido. Maybe their moods. Maybe they don't sleep well. They feel, particularly around their cycles, overly emotional. So there's several things we can do for them. We're looking at maybe thyroid, maybe testosterone, maybe progesterone. Progesterone, they call it the happy hormone because it kind of levels off the moods. Their progesterone is practically zero the first half of their cycle, then it spikes, and then when they don't get pregnant, it crashes again. They feel that. Men will talk about being level and stable and fluctuations and all that. And yeah, I'm almost like, you just need to shut up. You don't know what it's like for the women because they're all over the place and we just don't understand that and we don't relate to that. And I get it, but nonetheless, this is a real issue for some women. Some women are just like this. They don't fluctuate at all in this regard. Others, it's a real problem from them. Also, in terms of enhancing their libido, well, that's testosterone. Thyroid. Thyroid helps, there's dozens really of low thyroid symptoms, but the major ones people think of are crushing fatigue, can't lose weight. They can maybe lose 5 pounds, but that's it. They continue to diet and they gain weight even. Very, very frustrating for them. Those are the major ones that we see for that age group of women.
And then what type of results are those women seeing?
Well,
and how quickly do those results show up?
Generally, I'm disappointed if they're not starting to notice some benefit in the first 6 weeks. Sometimes we've got to fish for the dose and we may have to try different dosing. And that's why we do follow-up labs. And it may take us a few months to get that figured out for that individual. There is no one-size-fits-all program. And I think that's huge. That's one thing that we don't do. And I almost hate it when most of our patients are obviously referrals, but they've talked to somebody else and they think they're going to get the same thing or they want the same thing. And well, that's really not the best for you. So we have to look at that as, you're a snowflake. We treat everybody differently.
Awesome. All right, let's go to the next age bracket then. So in the 40 age group with women, what symptoms are you seeing and what things are you seeing in their blood work?
Pretty much the same thing with women in their 30s. They may be getting a little perimenopausal. We check hormone levels to determine whether or not they're approaching menopause. And that could factor into the equation as well. But same things. Their body's changing, they're gaining weight, maybe they retain water, they're tired, testosterone helps with that, their libido's going, and then again, the moods. It's pretty much the same as women in their 30s. Same thing in terms of hormones we would use, thyroid, progesterone, testosterone.
Perfect. And then as far as those results, same kind of story, right?
Right.
So it just depends on the individual and how long it takes and things like that. Cool. So let's move then forward into that next age bracket of 50. So 50-year-old women, what symptoms are they seeing and what are you seeing in their blood work?
Well, now menopause. They're not going to have much estradiol. They're not going to have much, if any, progesterone. Their testosterone will typically be very low as well. Thyroid, all over the place. It may be fine, it may not. But they're hitting menopause now. So everything's gone. and they do not feel like themselves. That's tough. So now you've got dry skin, joints start to ache, hot flashes, of course, that's a major factor for them. And you should not have any hot flashes. That's a goal of ours when we're treating these women. And they're going to get estradiol. That enters into the mix where it doesn't necessarily for the younger women. But a lot of moving parts.
So then listing off those results that those women see, whether it's, for some, as you mentioned, a short period of time, a long period of time, what results do they see? And usually what time frame do we see that in?
Same thing. It could be anywhere from within weeks to months. Some people even say it could take as much as a year to get the full benefits out of hormone replacement therapy. That would include guys with testosterone and then, of course, the women with everything they do. But I think usually by 3 months, we've got them working well. Now things change. They might do fine for a year and then something changes. We don't really know what, but now we've got to start adjusting doses again. So that has happened too, because we've had so many women, this is men too as well, but now that we've been established for quite a few years, we've got a backlog of information with them. And we're seeing more and more women. Certainly over 40% of our patients are women. I don't think we've even looked demographically. So it's just like everything else. A lot of times the wife will push their husband to do it. The husband will push their wife to do it. The way I look at it in terms of a relationship, as long as you're both happy, then there's no right or wrong here.
Awesome. All right, let's talk about the boys. So 30-year-old men, what are you seeing as far as their symptoms and what are you seeing in their blood work?
Blood work's all over the place, just like everybody else. We do see guys with higher testosterone levels that have all the low testosterone symptoms. Well, there's a few other moving parts here. One in particular is something called sex hormone binding globulin, which is a protein that binds, just like its name implies, to testosterone. So we do see guys that have higher sex hormone binding globulin, therefore they have lower free testosterone. So that's a partial explanation why somebody with a decent testosterone level doesn't feel good while their free testosterone is lower. And sometimes one guy will feel a certain way with, let's say, a testosterone level of 600. Another guy, their labs could be entirely the same, and they're going to feel dramatically different. Again, I just attach that to individual differences and don't try to get too into the weeds with it. What can we do to get them feeling better? They decide for themselves what feeling better looks like for them. And obviously, we're not going to load them up on high doses where they're going to be super physiologic. We'll go a little higher than maybe the ranges of what the lab ranges are, but that's going to be on an individual basis too.
Cool. So what results are those gentlemen in their 30s seeing once they start the testosterone, DHEA, things like that?
Well, pretty quickly, the libido. Their sex drive and sexual function should jump up noticeably. I'm really disappointed if I don't hear that they're doing great in 6 weeks. Now, the other things like putting on muscle, losing fat, that takes a while. That takes several months. And as I mentioned earlier, even up to a full year. I'm going to say generally about 6 months to where you really start seeing some change. And I noticed that particularly myself. I did not change my diet. I've always eaten pretty well. I credit that to my wife. And I've always worked out. I didn't change a thing. I just noticed at about 6 months that my clothes weren't fitting, particularly pants. And I joked that I'm spending more money on alterations and new clothes than on testosterone. Of course, that was easily true, but I lost about 5 inches off my waist without altering anything. So we expect to see some fat loss. That's just going to take longer.
All right, let's jump to the next age group. Gentlemen in their 40s, what symptoms are they suffering from, and what are you seeing in their blood work?
40s more likely to see dyslipidemia. And that is their testosterone being lower. A lot of times their estradiol will also be lower with that, and that's not necessarily good for their heart. But what brings them to us is the same thing. Men were the same. We want to have more energy. We want to improve our libido. We want to have more muscle. We want to be stronger. So even older men, and we can go on into the 50s and the 60s, there's not really any kind of delineation between those decades. It's the same thing that we're after. They just want to get some of their youth back and feel good like they used to. We think of it in terms of getting them to a young man's level on their hormones.
All right. The last question I have, and it was something it was a little heavy on me when I first got started. Am I signing my life away? Am I going to be on testosterone for the rest of my life? Is this something that once I start, I can't stop?
You've always got choices. Guys do stop, and you can stop. They say, well, once you go on testosterone, you're on it for life because your levels won't come back naturally. That does happen. I see that more with younger individuals, though. And again, this is just my thinking this through. A typical scenario would be a high school football player, and he wants to bench press 3 1/4, and he wants to put on 30 or 40 pounds of muscle and get a college scholarship. So he starts dabbling in underground black market anabolic steroids from somebody at a gym or something. So yeah, they get over 300 in the bench. They put on some muscle. Football season's over. They may stop. And then they lose that size. Their strength goes down. And as a guy, that's not something we want to accept. And as a 17 or an 18-year-old, no, that's out of the question. You know, you're not going backwards here. So they wind up staying on, and they're taking testosterone and anabolic steroids. So fast forward several years, now they're in their mid-20s maybe, and they're starting to think, I can't do this forever. So they stop, and they feel terrible, and their levels are very low. They haven't recovered. There's some things you can do to help with that sometimes works. Sometimes it just doesn't. I think what happened with them is they started taking anabolic steroid hormones, testosterone hormones at a young age before their own natural endocrine system gained a foothold. So it never got a chance to get up and running. Whereas you take a guy maybe late 20s, 30s, certainly 40s and 50s. We had guys 60s and 70s coming to us. So if you take a 40-year-old guy or a 30-year-old guy even, well, their body has had 15, 20, 25 years to be up and running and working. Now it's the point where it's not working as well as it used to. So they can stop taking testosterone. Their levels aren't going to stay. They're going to drop down lower, but their brain will catch on that, hey, what's going on? We're deficient in testosterone, and start making the gonadotropin releasing hormone, start making FSH and LH. I've seen some guys bounce back within 2 months to their previous FSH and LH levels. So everybody's different, of course. This is just theory of me trying to think this through. Where did this come from? Why did this be a thing? I remind these guys, well, your testosterone levels probably weren't that great before, or we wouldn't have been talking. You weren't feeling good before you started testosterone. Your testicles weren't doing a great job. So you think you can go on testosterone and then go off, and they're going to start doing a great job all of a sudden? No, you're going to go back to feeling as crappy as you were before, probably.
Well, I think we're good. I appreciate you taking the time, and we'll look forward to doing it again soon.
All right, good stuff.